When migraines follow the same script every month, with every workout, every late night, that's not random, that's a pattern. This was a woman in her early 30s who dealt with headaches since childhood, both migraines and more constant tension type headaches, up to about 15 days out of the month. And what stood out to me immediately wasn't just the pain, it was how predictable all of it was. Alcohol could trigger it, poor sleep, intense exercise, heat, like being exposed to too much heat, weather changes were another big one. And she also noticed that her headaches were much more likely right before her period, which is a very common pattern in long-standing cases just like this. Now, the pain often started in the back of her head with a lot of neck and jaw tension, and then it would move forward. And when it was a migraine, it settled behind one eye, and she would often experience a visual aura beforehand. She'd had imaging and lab work done, which she told was always normal, and then some treatments would help at times, things like sumatriptan, over-the-counter meds, and of course avoiding triggers, but nothing worked all of the time. Nothing broke that pattern. Now, when I see multiple headache types behaving this consistently over time with clear triggers and timing, that tells you this isn't random damage, it's a regulation problem. And until you understand the pattern behind that regulation, treating pain alone never really holds. We don't organize migraine symptoms by diagnostic labels. We organize them by patterns, by how systems in the body interact and regulate pressure, movement, and change. This is where Chinese medicine approaches headaches very differently. When I looked at her case as a whole, the headaches that traveled, this constant neck and jaw tension, that sensitivity to heat and weather, and the flare-ups that she would get before her period, those weren't separate problems. They were all expressions of one underlying issue. The way I often explain this type of headache and migraine presentation is like a hinge in the body. Now, if that hinge isn't moving smoothly, the structure isn't broken, but pressure tends to build every time something tries to move through it. In cases like hers, that pressure repeatedly gets forced upward and the head becomes the release valve. Now, in Chinese medicine, we call this a Shaoyang pivot issue. It's the regulatory space between systems that manage change, stress, and pressure. So the treatment wasn't about suppressing the headaches or the migraines. It was about restoring movement and regulation at that pivot. From a practicality standpoint, that meant using customized Chinese herbal formulas, not fixed prescriptions, and adjusting them over time as her system changed. As pressure eased and regulation improved, what the formulas needed to do changed as well. Now, when you treat headaches in this way, you're not guessing. You're watching the pattern respond. And once you understand the pattern, the treatment becomes much more precise and much more predictable. One of the biggest frustrations I hear from people with chronic migraines is that they don't feel listened to. They're given a diagnostic label like migraine or ocular migraine, tension headache, cluster headache, and then treated for the label instead of really looking at where the pain is, how it moves, what it responds to, what makes it worse. From the beginning, what mattered to me in her case wasn't just that she had headaches and migraines, it was how the pain behaved in her body. So the first phase of treatment wasn't about fixing everything, it was about reducing resistance, about opening things up so her system could start to regulate again. This is where her individual presentation, her story, her specific type of headache was so important. This is why custom herb work isn't about migraine formulas per se, it's about targeting the exact place where movement needs to open and pressure needs to release so her system can re-engage its own regulation. Within the first month, her headaches and migraines dropped dramatically. She still needed medication occasionally, but when she did, it worked better. Her system wasn't fighting against so much internal pressure anymore. And this is where a lot of people expect the story to end. But clinically, this is where treatment actually begins. Early migraine improvement tells you where to go next. And that's why adjusting treatment over time based on how the pattern responds matters so much in chronic cases like this. Now, relief is important, of course, but understanding how the system is changing is what allows the results to last. As the treatment progressed over the next couple of months, our focus gradually shifted. Now, not toward pain, but toward the pattern that was creating that pressure in the first place. At this stage, the goal wasn't relief anymore. It was about restoring regulation, making sure the system could hold its gains without being propped up. By this point, I had stopped giving anything specifically for her migraines. And her migraines did not come back. Eventually, she did ask me, do I have to keep taking herbs forever to prevent migraines? And I told her, we actually stopped directly treating your headaches and migraines 6 weeks ago. The reason your migraines are gone is because the mechanism that was producing them has been corrected. This is the part that surprises a lot of people. They assume you have to keep suppressing headache symptoms to keep results. But when regulation is restored, the body doesn't need to create pain anymore. At that point, the work becomes about stabilizing the change, not chasing any more symptoms. Something else started to shift during this stage, and we weren't even aiming at it very directly. We saw chronic acne improve, anxiety smooth out, and she became far less reactive to the triggers that used to set her off. But the core focus of the formula never changed. The same pattern that was driving her migraines, this Shaoyang pivot, the heat, the congestion, was always what we were treating. When you see multiple systems improve as the root is corrected, that's a sign the system itself is recalibrating. In cases like this, the secondary changes aren't a surprise, they're confirmation. This kind of outcome doesn't come from a single visit. It comes from paying attention to how the system responds and adjusting treatment as that system changes. This approach isn't for people that are looking for quick fixes or hacks. And it isn't for people looking for relief without participating in the process themselves. If migraines took years to develop, or if you've been dealing with them for years, why would we expect a 30-minute appointment to undo them? But if you're the kind of person who wants to understand your body and correct the pattern instead of just chasing symptoms, this type of work makes perfect sense. When the pattern is fixed, the symptom no longer needs to exist.